On May 30th, the CDC announced it is keeping its advice that children get the COVID vaccine, saying it will keep the COVID vaccine on the schedule of vaccines for children ages 6 months and older. And they suggest children and caretakers have a conversation with their doctor or provider about the vaccine. They also said that the vaccine is going to stay on the Vaccines for Children program registry, and that provides vaccines for about 38 million low-income children across the United States. There is no updated guidance from the CDC regarding pregnant women, however. But in total, that CDC announcement essentially contradicts that of Health and Human Services Secretary Kennedy that came just days before. Kennedy asserted that the CDC should drop its guidelines that the vaccine be administered to children ages 6 months and older and pregnant women. Kennedy's announcement skipped traditional recommendation protocols, which essentially is that the CDC advisors make decisions about which vaccines are recommended after they look at data and research and things like vaccine safety, rates of illness, hospitalizations, and deaths. The policy changes overall change some eligibility for the fall COVID vaccine, and the CDC's determinations can have an influence in setting insurance and public benefit coverage of those vaccines. It remains unclear how private health insurance and Medicaid will approach coverage of the COVID vaccine because the recommendation language coming out of the CDC is considered vague. Some experts predict coverage and access will be a real challenge in the months ahead. You can read more coming out of the CDC, especially its recommendations for children. We link to resources in the description below.